Hello, everyone, and thank you so much for joining us today. Although I'm sad that we can't be here all together in person this year for the McDonald International Symposium, one of the benefits of having this virtually session is that it is truly an international, and we have audience and speaker joining in from US, Israel, Uganda, and Europe. The coronavirus pandemic has disrupted nearly every part of our lives, socially, economically, and of course, our health. The pandemic will have long-lasting impacts affecting generations to come. The pandemic, in turn, really emphasized how we must be prepared to support kids, the future generation to come, so that they can be as successful as possible. And that's what our session is about today. Today's workshops, Challenges and Opportunities in Developing Child Savings Programs in Israel and Uganda is sponsored by the Social Policy Institute, the International Center for Child Health and Development, and the Next Age Institute. The conversation today will explore the implementation, the role, and the impact of child saving accounts in both Uganda and Israel. We will explore what's working well, what doesn't, and most importantly, what we can learn from each other. We also look forward to hearing from all of you. We are delighted to have our colleague, Olga Kondratova, Senior Data Analyst at the Social Policy Institute, that will moderate this event and facilitate the Q&A session at the end. And now let me hand it to Michael Sheridan, Director of the Center for Social Development, and George Ron Brown, Distinguished University Professor who pioneered this field.
Hello, it's a great pleasure to be here. I took a little time to get the connection going. I'm in the United States, but in a different part than Washington University, and this whole group is representing the whole world very nicely today. My job today is to set the stage for a discussion about child savings accounts, or we call them child development accounts. We'd like to emphasize development more than savings, but it means the same thing. And I will try to set the stage about this body of work and where it comes from and what we know so far and some progress around the world. And then and as McCall has said, there will be then in-depth presentations from both Uganda and Israel. And we're looking forward very much to that, to those presentations about how these policies and programs are really working on the ground. So this talk today is about asset building, progress of a policy innovation, and I'll use that title, but really I'm talking about child development accounts. If I can make the slides go forward here. Oh, yeah. This work has been going on for quite some time, and the McDonald, and I want to give credit to the McDonald Academy for hosting this event. The McDonald Academy partnership with the National University of Singapore has a special name, Next Age Institute, because we work on some policy innovations between our two campuses. So that connection, I happen to be the ambassador to the National University of Singapore also. So that connection has been working on this topic for some time. And this is a photograph from a conference that we had late in 2017 in Singapore. And you'll notice people's faces are a little bit small here, but you'll notice that McCall is in the picture, and Fred is in the picture, and John Gall is in the photograph. And I could introduce everyone else here, but they're from a number of different countries. I think we had 6 or 7 countries or territories represented at this meeting. So this reasoning about asset building is a policy idea, or we think of it as a policy idea that might take its place along income support, which is which has been the main policy idea in social policy. This is not to say anything against the importance of building incomes, but there are reasons why we should also focus on building assets. And one of them is that worldwide, there's a declining portion of income that goes to labor and a growing portion that goes to capital. And as a result of these trends, there's a rising inequality in both income and assets in most countries today. And that's a long discussion, but by and large, I think we can say that it's probably not a sufficient policy idea any longer to focus just on household incomes for household financial stability. In addition, building assets helps families develop, and there's a growing body of evidence that indicates that when people have some resources for investment in their education, skills, property, enterprise, they're able to lead a better life. And this is true for all families, rich and poor alike. We've had some limited idea about holding assets that only rich people should have that. But in fact, all households require some resources so they can make investments in their future. So asset building creates material conditions as well as outlooks and behaviors that promote household stability and development. Another really important point is that we already have these asset building policies. These are figures from the United States. So they operate mostly through the tax system. So we do asset building policies substantially. That figure in the US, depending how you count, is approaching $1 trillion a year. That's a huge amount of expenditure. Almost all of it goes to the top part of the income distribution. It's enormously regressive. So this is really, in our view, not very good public policy. And a better public policy would seek to build assets for the whole population. That would be more fair and also more effective in terms of supporting a population so everyone can do well. This vision of asset building as a policy concept has some principles, and the principles that we like to focus on, and these topics will come up in today's discussion, are universal, everyone is in, progressive, subsidies for the poor, and lifelong, beginning as early as birth. The design features, there's a longer list, but the ones that we think really matter are automatic, these accounts are open for people, whether they sign up for them or not. They can opt out, of course. So think about this as like plumbing or water delivered to homes. The system is set up, people are in. And for social development, so education, homes, enterprise, stability. The purpose, it's about money, but the purposes are largely social. So child development accounts or child savings accounts would start as early as birth for lifelong development. We have a long-running experiment in Oklahoma called Seed for Oklahoma Kids, which has been because of the research design, quite rigorous research design, so we can claim causality about the effects of asset building. And these are no longer really early results, but the results are that I'll skip this slide, it's about the research. The results are that the treatment group is able to accumulate assets in these accounts, and we're using the structure of a college savings plans, which are in every state in the US, so we're just taking advantage of that structure. And we're able to show that these assets can accumulate for everyone across both race and class. So this is quite different from the way assets accumulate in other activities in society. So we're able to show that you can implement a policy, bring everyone in, and everyone can do well, basically. The automatic features, in fact, have greater positive effects for the most disadvantaged children. So again, the importance of being automatic and bringing people in. And this is about more than money, and we can't go into this, but we have actually quite a growing list of effects, positive effects on families with child development accounts. And coming from this experiment, so families tend to have, as a quick summary, tend to have a little more positive outlook and improved child development. These are not massive effects, but they're statistically significant effects, and there are various features that support that. So, and we've also learned a few lessons in the process. So one of the lessons, I can't go do them all here, but we'll just do a couple. One of the lessons is that full inclusion requires automatic opening of accounts. If there's not automatic opening, the policy will miss the most disadvantaged children. Another lesson is should start early in life, as early as birth if possible, so that assets can accumulate over time and so that families can know that the account is there, which also has a positive effect, regardless of the fact that their assets accumulating in the account. The idea, and we're able to show this statistically, the idea that the family has an account for the child's future has a positive effect on the family. And another important point is that although we support savings and we do savings matches in child development accounts, the reality is that the poorest families are not going to be able to save very much. So in our view, it's more important to emphasize asset accumulation and not so much savings behavior, although savings behavior is certainly desirable. So because of the CDOK research actually, and a lot of other research on child development accounts has actually been quite influential in informing policy and policy progress. So a quick summary of that. We're committed to, and McCall and Fred also very committed to, and John Gall, taking applied social science to policy, not just publishing an article. So these are staff members at Center for Social Development. This is Margaret Clancy, who leads this work in the U.S. for us. This is Willie Elliott, who's now doing this work at the University of Michigan. I like this story because Willie now is the chair of the doctoral program that I graduated from. So Willie is a good friend and colleague, and now has come full circle. I learning from Willie in that position. So we've made policy progress in the U.S. So these states listed above, Maine, Pennsylvania, Nebraska, Illinois, all have passed universal automatic child development accounts at birth for everyone born in the state. There are several other states that have a kind of lesser version of that in some ways, not quite the policy design we think is perfect, but these states actually have passed really important legislation. And so each birth cohort now in these states gets a count. So hundreds of thousands more children every year will have a child development account just at these states. And there's lots of discussion going on in other states, including our state of Missouri. And the other point I would make about this is that you'll notice these are not just red states or just blue states, but these are every color states. They're blue and purple and red here politically. So this is a very bipartisan concept. We can work across the political aisle, and we certainly do. So and at a time when politics, at least in America, are so divided and divisive, you might think about this as a kind of breath of fresh air that both Republicans and Democrats can work together. There's a lot of city level child development accounts happening in the US, and you may know that Washington University is near Ferguson, Missouri, and the Ferguson Commission after the disturbances and the killing of Michael Brown in Ferguson did a very thorough report and recommending child development accounts, and that discussion actually now has gone to the whole state of Missouri, and there's the COVID virus has intervened a little bit in the politics because the legislative chambers had to shut down, but there's a real commitment to picking this up again when it's possible to do. There's national discussion. So this national discussion on child development accounts in the U.S. is underway. Again, we have a legislature or Congress in the U.S. that a little bit dysfunctional for the last few years. We can't really make much policy progress, but hopefully that will change with the elections in November and can start to pass legislation again. But there is underlying support in various ways and with variations on the idea of starting children with an account at birth. There's an international diffusion of this idea. Singapore's child development account started in the early 2000s. I was a visiting professor in Singapore in the early 1990s and have had relationships ever since. So these ideas also very Singaporean because they had asset building policies before this time, but they didn't apply to children. The United Kingdom had child trust fund from 2005 to 2010. New government came in and put the project aside, but those kids, the oldest kids, because they did retroactive back to 2002. The oldest of those kids are ready to go to college this year, and some of them have up to £20,000 in their account. So we're talking with people in the United Kingdom about following up on how those kids are doing in their transition to college. As you'll hear today, there's wonderful work happening in Uganda and other parts of Africa, led in large part by Fred Sewamala and his team, and he's built a very effective team on the ground in Uganda to do applied research, and you'll hear more about that. It's a wonderful story. Korea started child development counts in 2007. They're having a conference to celebrate the 10th anniversary of asset building in Korea. And it's really trying to move the policy to a larger portion of children. Their first goal was to reach half the children in the bottom half. And their longer term goal is more ambitious. And you'll hear today about child development accounts in Israel, which were enacted in 2017. I won't say too much more about that because it's a wonderful story, and John and McCall are here to talk about it. There is CDA policy in Taiwan and a plan now to open an account automatically for every children. There's policy meetings in Azerbaijan and also in other countries. So the larger picture is that this discussion is happening in different places around the world, and I don't want to overstate the impact of this, but it's sort of like sprouts are growing and people are trying to figure out how to do this, and countries are learning from each other. And in that regard, it's a very interesting period. So the policy in Israel, McCall will talk about more, but this is policy development's always a long-term process, and this policy discussion began in the early 2000s, really. It was first led by Vered Slonim-Nevo, a former faculty member at Washington University. And in fact, I was working in Israel when I first met McCall in Israel. She was at the time thinking about applying to PhD programs. So we were fortunate she eventually came to Washington University and has done, had a remarkable career. And she doing this work and helping to lead that project. You'll hear more about it. And I was honored with a PhD from the Hebrew University of Jerusalem a few years ago. I think John Gall and his wife Edith had something to do with that, and I think largely because of this work. So I think I'm seeing Olga, so my time might be up, but I need like 2 more minutes. Okay, thanks, Olga. So Fred also was a student at Washington University, applied for our PhD program, was admitted, and then he helped build an Asset Africa group when he was a graduate student. He went on, he's not going to tell you all this, but I will say it. He went on to Columbia University, became a star as a young professor, and was mentored there by Mary McKay, the dean at the Brown School now. And Fred has learned how to be enormously successful in getting NIH funding to study health and mental health effects of assets among HIV orphans and other populations in Uganda. He does work in other places in the world also, but that's what he's most known for. So there's also international discussions happening. This is meetings in Azerbaijan. This is with Aytakin Husseinli is at the table. This is the social development minister in Azerbaijan. And Aitaki is also a PhD student at Washington University. She's really carrying that work to Central Asia and the Caucasus. So I love this picture. We were doing a youth save project in several countries a few years ago. These are children from Ghana. They have a lot of hope in their faces, and I think about someday, perhaps someday we can have an account for every child on the planet. I know this sounds ambitious, but really we have the technology to be able to do this. So there's a lot of potential for more cross-national partnerships. It will lead in a longer vision, it leads to asset building for all, which could be a massive social innovation, but it's of course one step at a time. So the closing is that all of this work, as you see from the great work of the people on this panel, all this work didn't just happen. People, you know, the policy ideas don't just sort of show up. People have worked very hard to shape them and put them in place. And that hard work really is such a pleasure to take part in with such wonderful colleagues. So I think the panel today is a small, I won't say small, an impressive example of that. Thank you very much.
Thank you so much for this presentation and the overview of the programs around the world, and thanks to the audience for joining today. As a reminder to audience, we will be having a Q&A session and discussion with all speakers in the end of the event. So please feel free to submit your questions using the Q&A feature at the bottom of your screen. So for the next presentation, it's my pleasure to introduce our next two speakers who will discuss the Child Development Accounts programs in Israel. Dr. Michal Greenstein-Weiss is a director of the Social Policy Institute and the Shanti Kanduka Distinguished Professor at Brown School, Washington University in St. Louis. And Dr. John Gall is a professor at the Hebrew University of Jerusalem and a senior researcher at the Taub Center for Social Policy Studies in Israel. So I will give the floor now to this group. Thank you.
Seems like I'm muted. Okay, hi everyone. Hopefully everything is working. So thank you, Michael, and thank you, Olga. And I'm delighted now to really share with you a little bit of the story of, you know, the Child Development Account program in Israel and the work we are doing there in partnering with the Israeli government and the National Insurance Institute. So I will get started and then Johnny will continue. Okay, so why child development account in Israel? Israel has the highest poverty rate among developed countries and is one of the highest level of economic inequalities. And about a third of the children in Israel are living in poverty, and this trend is continuing to grow and have risen a lot in the past 10 years. Another reason that Israel seemed like an ideal country to have a child development account or child saving account policy for that is because Israel already have an existing infrastructure that allow for the government to deliver money every month to the child or to the mother. The existing infrastructure prior to the children's saving account was the monthly child allowance, which is an entitlement grant that provide every month a stipend, income support into the mother's account to use for children. With more children, the amount increase, and it's equivalent of about $45 in America. And the allowance was universal, like Michael was talking about important component. That was one of them. It was universal. It was paid regardless. It is paid regardless of family income. Everyone is receiving it. So that shows us like infrastructure that has a potential for automatic saving by the government and to make it universally. And we used to present that with working with many colleagues in Israel, we used to present that as a potential for Israel. The idea, the vision for this policy is that opening a child development account for every child in Israel will create both the opportunities for all children and narrow wealth inequalities, and it both will support the everyday needs, because it's not instead of income support or instead of the child allowance, it's in addition, but allow also families to plan for the future. So the idea is building assets for everyone, but we suggested that as a progressive policy that will also provide additional and more resources for the poor. It didn't pass like that. So some of the stories, and as again, we're sharing your pictures, and you can see, people, you can see all of us kind of always working together. So this is a trip that we had a delegation of people from the US, including Michael and myself, and Ray Bushara was in New America Foundation, and Mark Ivry, that was senior advisory to the Secretary of Treasury, all joining me to come to meet with then the Minister of Social Affairs, Buzi Herzog, and the head of the National Insurance Institute to present this idea of a children's saving account, building on some discussion that already have been happening and kind of framing it as a real policy proposal. The meeting happened in 2010. I received a small grant from the University of North Carolina, and were able to, kind of like get everyone to fly to Israel and have this meeting and host them there. And that created a lot of enthusiasm and excitement by Minister Herzog, who was overseeing the Ministry of Social Affairs. And immediately following our meeting, he decided to take the idea and actually took our proposal and drafted it, the first bill that was introduced a few months after we left in the budget discussion in 2010. The bill did not pass, but did not fail. It was pending. And through the years, through the next several years, it kept getting more people to support it, and was introduced again in 2014. What happened in Israel was also that there was a golden moment that allowed for political feasibility. The year before that, in 2013, the Treasury Department cut a little bit the child allowance. And when there was the election in 2015, the Haredis, to join the coalition and to create a government, really pushed that they increase child allowance back. The rest of the people kind of resist this idea. So then there was this idea of the child saving account that was already an existing proposed legislation, and that's really what helped create a coalition, and that really was the momentum, and it's kind of what we call it a golden moment, and that was a compromise. The religious people will get their money back, but the money would not go immediately to the child allowance, but will go for the future of the children. And that make everyone happy, and that's how the bill passed in 2015 with the rollover in 2017. So it was a win-win, and the former government with this CDA proposal play a big role in forming that government. There was a lot of excitement in Israel, tons of stories about the first country to have a monthly saving account, a universal program, and really a lot of enthusiasm around that. So how it is working? The government automatically opening children account for a children saving account for all kids under the age of 18 on the child name, and they roll over within 6 months the entire population of kids. So they didn't start just with newborns, they just roll over the entire population of the kids and open saving account to everyone under the age of 18. A government deposit a monthly 50 shekels, which is the equivalent of $15 until the kids are reaching the age of 18. There is a few bonus, kind of like bonuses of money inflected into the account throughout important timelines as well. And kids can get the account get the money out when they are 18 with the parents' permission, or at 21 without parents' permission. The goal is to keep it as long as possible, and in Israel it's mandatory that everyone go to the army, so it makes more sense to have access to the account at 21 as opposed to 18. Once the kids reach 20 years of age, there is no restriction on how they can use the fund. So this is really the first universal child development account with monthly deposit from the government. And what parents have to do, parents had like 3 important decisions that they needed to do regarding to this money. They can choose to invest additional 50 shekels from the child allowance, not other money, not other savings, not from their own pocket, but from the child allowance. So instead of getting 150 shekels in the child allowance and 50 shekels to the saving, they can divide it as like 100 to child allowance and $100 shekels to the saving account. They can also choose where they want to deposit the money, whether they want to deposit it in a bank account that have relatively like low interest, in a religious fund, or in an investment type. And then they have the choice of like low risk investment fund, medium, or high risk. If the parents do not make a decision, the child will receive automatically, so the government will choose and they will receive automatically the 50 shekels with a low yield investment fund. So it can be the bank or just the low yield. And that's what Michael talked about as a universal. It's like, it's not an option that people have to do it. Like here they have the options of whether they want more money or where to save, but they don't have an option if to do it or not. If they're not making an active decision within the first 6 months, the government will choose for them. And why that matters, why it's really important, like, and why we believe as researchers that it's important where they invest the money and whether they add additional 50 shekels and how long they keep the money there, if they take it out at 18 or 21, when there are 2 more bonuses of also of like 500 shekels, because the money that can be accumulated and the difference can be quite large. And you see a table with like different numbers that showing the different amount that it can be accumulated to. And I want to just go with you through the 2 kind of like to the 2 range, right? The lowest accumulation and the highest. The lowest accumulation, it will be like 12,000 shekels, and 600 and something. And it's not little, and it's definitely a very nice amount, and it will cover here 1 year in college. But the other range, the other spectrum, come up to almost 73,000 shekels, which can cover full bachelor and master degree in Israel. So quite a big difference. So we have partnered with the National Insurance Institute who allow me and my team to actually get access to the administrative Israeli data of the 3 million kids who are in 1.3 million households. Olga actually had, we were like really excited to have Olga visiting and Stephen on my team visiting in Israel and actually sitting and running analysis on this administrative data and looking what we can learn from the saving deposits in the first 3 months, in the first 6 months, which was the rollover. And we did, different analysis, but today I want to just focus on kind of the very basic and the really important decision. We looked on whether people decide to actively enroll in the program. We looked on people decided to choose an additional 50 shekels and where they decided to invest the fund. So actively enroll versus the government just like choose for them. So what we have learned. We have learned that 67% were actively enrolled in the program. They sign in and went to the website and choose what they want to do for their kids, which is quite a lot. We were pleased with this number. About 40% of them choose to save in the bank, 13% in the religious accounts, and almost half choose to put it in investment account. Out of the 67% who were actively choosing, 64% chose to deposit additional 50 shekels, which is also, quite large number, we believe. I want to share with you one of the screen. This is in Hebrew, so I'm sure, just a few of you can read it, but this is kind of the choice. And what I highlighted in red is that we also use a little bit behavioral economic techniques here, while the choice of adding additional 50 shekels into the account is already marked, and people kind of need to unmark it if they don't want to, choose. And we believe that's part of why it make it to relatively high number of people choosing a different additional 50 shekels. So we also wanted to look like what's the role play of demographic and financial characteristics on the parent choices. And we can see that the decision whether to actively enroll actually was the highest group who actively enrolled, 86% were ultra-Orthodox, because they got like, and it was funny because if I show it to you over time, they did not enroll for the first 4 months, and then like in Passover, that started in January, and in Passover, which is in April, the rabbi decided they make some deals, and they told everyone to enroll, and within like 2 weeks, the whole population enrolled, and ended up being the highest enrollment rate of 86% of the ultra-Orthodox who actively enroll into the children's saving account, followed by the Jews, and less than half of the Arab population enrolled. The decision to put additional 50 shekels, actually the Jews, almost 75% of them decide to do that, and about half among both Arab and ultra-Orthodox decided to deposit additional 50 shekels. Looking on where people decide to deposit, we see that Arabs mainly choose the bank account, which yield the lowest return, so this is a little bit disappointing. Ultra-Orthodox went with the religious option, which that's what would be expected, and the Jewish people, the Jewish non-Orthodox went with medium and high yield investment fund. Looking on parents and income, we see that across the spectrums, more financial, more savvy households with higher income are more likely to actively enroll, are more likely to deposit additional 50 shekels, and are more likely to choose an investment fund. So a quick summary, economically vulnerable religious and ethnic groups, the ultra-Orthodox, tend to be more conservative in their investment choices, and the more affluent households were more likely to enroll, were more likely to deposit additional 50 shekels, and more likely to invest in higher yield investment fund. So as currently designed, the program will clearly improve the overall financial security of Israelis, the generation who's growing with this children's saving account, but might help more to the more financially savvy individuals who have higher income, and they might benefit more. So I will finish with kind of introducing the research team that now are actively engaged, and this is a partnership between the Social Policy Institute and NII, which is the National Insurance Institute, and IDC, and this is our kickoff meeting, and we now received a large grant from the National Insurance Institute to use behavioral economics techniques to try to help the active participation and enrollment to the program, and maybe choosing a higher investment and additional 50 shekels among Arab families and the ultra-Orthodox. So with that, I'm passing it to Johnny, and thank you again.
Right, thank you. Thank you, Michal, and let me see if I can get this to work. Okay, just 1 second. It doesn't go back, so okay, I'll start here. It doesn't matter. This is fine. So my name is Johnny Gal. I'm from the Hebrew University, and what I want to do is really to discuss some of the things that have happened to the program since it was adopted in 2017, and to highlight some of the challenges that this program is facing or may face in the next few years. I think there are two major issues that I think we should think about with regard to the CDA program in Israel over the next 2 years, or two issues that I think are problematic. The first issue, of course, relates to economics, or to the state of the Israeli economy and Israeli government. What I think we're all seeing in all of our countries now, of course, is that the pandemic, the COVID-19 pandemic, has really stretched or put a lot of pressure on governments to spend a lot of money on social programs, social welfare programs, but also has created fears that the budget deficits will be very high in the next few years. And I think what we should be very aware of or take into account when we talk about CDA programs, which is what and the CDA program in Israel, is that there may be a danger that in a year or two, when the pandemic is over and when the crisis is sort of settled a bit, then there'll be cuts in budgets, in social welfare budgets. And I think what we should be worried about in the Israeli case, and perhaps in other countries, is that this program may be one of those programs that there'll be a threat that will either be cut or changed significantly. So I think we should be aware of that and try to think of how we make sure that that danger does not occur, that danger of the program disappearing occur. That's a problem, because I think this program is perhaps one of the most innovative social welfare programs adopted in Israel over the last few years, and in fact on a very non-partisan basis, which is something that Michael mentioned in his talk. It's innovative because it's really a program that reaches all children, that can contribute, I think, very, very significantly to the social mobility of particularly children from low-income families when they become young adults. And as Michal explained, we're talking about a relatively significant amount of money. In research undertaken by the National Insurance Institute, they're talking about an average amount of the equivalent of about 6,000 American dollars. So the first issue that I think we should be aware of, and we should take into account when we think about how this program will move forward, and how we change policies in order to ensure that that occurs, is the issue of how do we make sure that it is resilient and can overcome any sort of policy attempts by policymakers to cut the program, or to do what happened in the UK in 2010 when the program was abandoned. A second issue is something that I think we should think about, and that is the issue of inequality. And we should be asking ourselves, to what degree does the CDA program, as it exists today, to what degree will that deal with inequality, or perhaps even increase inequality when people become young adults? What you can see on the screen now is really data that relates to the most recent data that we have, and relates to children who were born in June 2018 in Israel. And what you can see very clearly from the data here on the screen, you can see that firstly, that active enrollment has dropped from 67% when the program was initially adopted, to about 45 or 46% today, which perhaps is not particularly low in programs of this type. But what we should be worried about, I think, is that amongst the Arab population, which comprise about 20% of the population in Israel, and very often tend to be in the lowest income population in Israel, only 18% or even below that of Arabs actually actively enrolled in the program. So this is something that I think we should be bothered by, and it's particularly problematic. The data that you see below that, only 7% of the lowest quintile, so the lowest 20% of the population in Israel, only 7% actively enrolled in the program. And on the other hand, 88% of the highest quintile actively enrolled in the program. So what we're seeing here is a very, very major gap between the low income and the high income population, with the low income groups in Israel not actively enrolling in the program, or actively enrolling in to a very limited extent, while the opposite is the case, the highest 20% of the population. The same goes for the additional deposit. So as Michal said, parents can add another 50 shekels, another small amount of money, $15, to the savings if they choose to do so. But what we see is this is the case for only 20% of the lowest quintile, so the lowest income population in Israel. On the other hand, over 50% of the highest quintile actually do so. So we should be worried, I think, very much about how the enrollment process is taking place. And let me try to frame it in a different way. And I want to use a term that originally coined by sociologist, American sociologist Robert Merton. The term he used was the Matthew effect. What is the Matthew effect? Well, the Matthew effect is a term that was really taken from the New Testament, and it's a quote from the book of Matthew. But the basic idea is that initial advantage generates further advantage. And we use this very often in the social policy discourse to refer to a situation in which social policies benefit disproportionately the middle or upper classes relative to other groups in society. Or basically what the Matthew principle means is that people with higher incomes enjoy more social policies than do people with lower incomes. And there is quite a lot of data on this in the social policy discourse, and the reasons for this may differ, but basically we see this is the case for higher education, for early childhood education and care, for labor market insertion policies, and even different sorts of benefits. And what we can see here, and what I think we should be worried about with regard to the Israeli CDA program, is this is what exactly is what is happening in the program now in Israel. The result will be, if we don't make changes in the policy, is that while both low income and high income young adults will be receiving money from the program, the young adults coming from higher income families will be receiving more, which of course is not helping to deal with inequality within the population. So what I really want to touch upon in the few minutes that I have left is to try to think about how do we ensure that the CDA program continues and it will continue to benefit children or young adults in Israel, and how do we try to diminish to a certain degree at least the impact of the Matthew effect. So here are some policy recommendations that I hope can help address these issues. They're really going back to the ideas that Michael spoke about in his talk. So, and they emphasize, I think, this issue of a child development rather than child savings account. And we're trying to think of how can we make sure that we can ensure both options for social mobility when people become young adults, but also how do we ensure that this program leads to greater equality and does not undermine this struggle for greater equality in a society which, as Michal showed, has very, very large gaps between different parts of the population. So I think a very important component must be the universal structure. Universal programs of this type of CDA, they both ensure that there's full take-up of the program, so everybody gets it. And not only some parts of the population, all parts of the population get it. We have no issue of non-take-up, which is crucial in programs of this type. It's very simple to administer, but also it generates greater public support because it's universal and cuts across all parts of the population. I think we need to build in more progressive features, which is also something that has been discussed here before by Michael. And the suggestions differ, but the basic idea is that we find ways to offer low-income families with additional deposits and enable them to increase the amount that they have saved for their children. This can be done other ways. We can change the default investment so that parents who don't enroll actively in the program will not receive only a low-yielding investment, but their money will be invested into a higher-yielding program. We can incorporate different matching mechanisms for low-income families, either by enabling the families to save more money and the government match these, or by enabling other families or extended families or NGOs to put money into these programs and let the government match them. And I think we really need to think about creating public awareness, making sure that people know the program exists, and particularly making a big effort to reach the Arab population, which is one of the problems I think that the program faced initially because of language issues. So what I think really, and I'll end on this issue, really I think what we need to work very hard, at least in the Israeli context, to make sure that the CDA program continues, but we have to make sure that it continues to be a universal program with those progressive features that will make sure that we reach particularly lower income families, and make sure that the program will both lead to social mobility, but also to greater social equality. Thank you very much.
Thank you so much for this presentation on the program in Israel. For the next presentation, I would like to introduce our next two speakers who will discuss the Child Savings Account program in Uganda. Dr. Fred Siwamala is a director at the International Center for Child Health and Development at ICHAD. He's also director of Smart Africa Center, and he's a Williams Gordon Distinguished Professor at Brown School at Washington University in St. Louis. And Dr. Timothy Opopo, who is an executive director at AfriChild Center at Makerere University in Kampala.
Yeah, thank you so much, Olga. Thank you so much, Mikhail, and thank you so much, both Michael and John, for an excellent presentation. You made my work easy. For some of you who know me, you always know that I start by thanking Michael, because Michael wasn't only my professor at MSW level, but Michael is the reason I entered a PhD program, because he was the chair at the time and he encouraged me to apply. So whatever I do right is because of Michael's encouragement for me to get in the doctoral program, and whatever I do wrong is because I didn't listen to whatever I may have said. So what we are going to do really is to, you have heard from how this work has been done in, in developing countries. And Michael gave us Mikhail has done a great job of how this happened in Israel. Michael gave us a great took us on a journey on where it started and where they are. Now, the work we do across sub-Saharan Africa, and now we are starting to do some of it back here, is done by a group of committed people, and that's the picture that you see there. These are just a few of the many people that are doing the work, that are trying to move this work forward. Work around, I prefer calling it really children development accounts, because in Uganda and in Kenya and in Ghana and in Nigeria, some of the places where we have worked, these accounts, like Michael indicated and Mikhail has indicated, they are not simply about earning money. They are not simply about having the money in your pocket. At least the way we look at them in Uganda and in other places where we work, that they are impacting young people's behavior in a very meaningful way. And so that's the argument we have used in Uganda. And when you look at the title of our presentation and the title that we were given, I kind of flipped it. And what I did is, or what we've done with my colleagues, is instead of starting with challenges, we want to begin with opportunities. Because if someone is telling you that a poor country or a poor region is implementing these children's savings accounts, I think that the issue is not what are the challenges. I mean, that's given that we are working in the poorest region on earth, the region with the highest disease burden. But now what are the opportunities? And you are going to see what opportunities we have, and then we can talk about the challenges. So it's an approach of the glass is half full or half empty. We are looking at this as the glass is half full. So in the video that you are going to see, you are going to listen to our minister talking about where we are right now, and then I'll let you know where we came from.
According to the plans by government, beginning in the 2018 financial year, every newly born child as recorded in health facilities will receive 23,000 shillings monthly from government.
$6 is 23,500 shillings per month per child. So when you give it to a mother, this is when the mother needs our support most. In fact, you're saying that you breastfeed, eat well and be able to breastfeed. If you're rushing to go back to the market, don't go, because you can earn this 23,000.
The State Minister for Youth and Children Affairs, Florence Nachwara Kingi, told the journalists that the plan was approved by the Minister of Labour, Gender and Social Development, and now awaits approval by Cabinet and Parliament.
A proposal which was approved by the ministry yesterday of ensuring that we get cash grants to mothers. So these social actors look at cash grants as a more important means of mindset change than items.
So thank you so much. So what the minister really has talked about is exactly what for me and Michael maybe and Mikhail, they talked about, Michael used the word plumbing, that you are building the plumbing or you are putting in place a plumbing. And Mikhail talked about infrastructure. Now, a country like Uganda, which doesn't have the plumbing on how to deliver a program, that magnitude of a program, the moment you start working on changing people's and policymakers' minds around issues of you can create this and you can engage families and families can benefit and families can save, I think that's what we are trying to do now. So for the past, I graduated from WashU in 2003. Michael was my dissertation chair. I worked for the Center for Social Development. So when I left in 2004, we embarked on this work. And when we embarked on this work, really, I know that unfortunately my work has been now categorized as work which is focused on children who have been affected by HIV and AIDS. Our work has gone beyond that. So that's where we started in 2003 and 2004. The reason we started with that kind of framing was if the poorest of the poor and the most vulnerable of the vulnerable can engage with this system, if you give them the opportunity for them to engage with financial institutions, for them to save. And if this can change their way of thinking, then those ones who are not worse off would definitely take advantage of the system better. Just like actually John and Mikhail have indicated what is going on in Israel. So that's why for us, we started with the bottom, the worse off in terms of society. So we were able to, and we were among the first, but we were able to apply to NIH and really looked at this not simply as a children's savings account, but as a children development account that is going to impact young people's behavior. That, of course, is going to impact their welfare, well-being. That is going to impact their development. That is going to impact educational outcomes. And but at the same time, where we are going to automatically enroll these young people into financial institutions, and then where we have to convince financial institutions that young people and their families can save, and that if you incentivize their savings, that other people can contribute. So what you see are the different studies that have been funded. I didn't put there about 3 of them because I have only a few minutes. But what you see really are the different studies that have been funded by NIH around these issues. And so what we are trying to do, we are opening up the first study, which is Bridges, the one you see right there, the very first one in terms of on this slide, was in 48 schools in 7 districts of Uganda, 6 to 7 districts of Uganda. And here really we are trying to figure out whether if you engage young people in primary school and their families, will they save? And if they save, if you give them a match rate of 1-to-1, and you give the other group a match rate of 2-to-1, what will be the saving differences? And what are the costs? So we are trying to do that work, put in place an infrastructure, put in place the plumbing that is needed. And all our work is that we use cluster randomized control trials. So in all our work, we try to make sure that children who are in a given school receive the accounts, and children in other schools may not receive the account, and children in other schools may receive an account which is matched differently. So the first study, that bridges that you see, is about schools, recruiting young people from schools. The next study that you see is about recruiting young people from healthcare clinics, and from hospitals. Can we use hospitals to recruit, and can we use hospitals to engage with families? The next study, which is called Chaterekera, we are recruiting out of communities. So because if we are going to get universal in a country where a big number of people live in rural areas, and where many of them, unfortunately, some young people drop out of school early, you want to figure out multiple ways of getting to them. So that's what we have been doing. And in all our work, what really we do, we open up an account for young person. So from the word go, we are opening it up. We match it. They get to know that they have the account. We match it, and then they can use that money for post-primary education, for starting a small business, or these days for treatment, healthcare treatment. So the next slide, I'm going to tell you the coalition that you have pulled together. So the coalition really, for us to be able to do this work, we have engaged civil society, we have engaged the business sector, we have engaged parents, and we have engaged the media, because there's no way we can do this work without having these partnerships. And so the person who's going to present, who is a co-presenter with me, Timothy Okobo, is really very, very much involved in all this work, and it comes out of both the I want to say the business sector partly, but also out of the civil society. So we are engaging them in a very meaningful way. And in the next slide, really what I'm going to show is that we have now penetrated even financial institutions. When we started this work, banks didn't think that you can open an account in a child's name and that these poor kids could save. But right now, over 6 financial institutions, 6 financial institutions that we are working with across the country have what you call children savings accounts. And many of them are the ones approaching us on how to design this. So for me, that's very exciting, at least at the regional level, at the country level, leaving alone the fact that the government is interested, but also financial institutions as a private sector, which is a for-profit, is very much interested. And then we have not stopped there. In the next slide, we have been consulted. Some of you may have heard about the DREAMS project. Can you believe that now USAID, the Bill and Melinda Gates Foundation, and UNAIDS, these organizations which are looking at how do you intervene with young people who are being affected by HIV, who are being affected by poverty, how do you intervene? That saving is part of their menu. That I was consulted heavily to be able to for them to be able to incorporate this. And this the DREAM study is in over 10 countries across sub-Saharan Africa. And really that's very exciting. And these are some of the countries. So I just wanted to give you a framing of where we are, given the time we have. And I want to be able to pass this on to my colleague, Timothy Okobo, who is the executive director that we have worked with to penetrate the government of Uganda and to get them interested. So Timothy, you can take it from here, please.
Thank you very much, Professor Fred. And again, I'd like to say it's a privilege to be part of this conversation and discussion. I just want to build on Dr. Fred's presentation and weave in the policy aspect in the work that we've been doing collaboratively with Professor Fred. I am from the ICHAD Center, and we are based out of Makerere University. The ICHAD Center, of which Professor Fred is actually one of the founders, is a center that is essentially undertaking child-focused research, but with an aim of using this research to be able to influence policy. And the thrust of our work has really been trying to bring evidence to the policymakers and getting the policymakers to appreciate this evidence and then translate this evidence into policy. And so we, in discussions with Professor Fred, were thinking about the work that has been done and how valuable that work is, and pondering on how do we get the policymakers in Uganda to actually appreciate this work, but not just appreciate it, be able to translate it to change the lives of the most vulnerable groups. And in the last 5 years, we have gradually built relationships with the policymakers. And I think this, for me, is one of the critical aspects that we have been able to actually achieve with the Smart Africa and ICHAD, working very collaboratively. Working very closely with Professor Fred, we've, first of all, targeted multiple stakeholders. Professor Fred, in one of the slides, showed civil society, the business sector. And what we have done really is look at different levels, understanding that policy, although is actually finally determined by the government, but it's influenced by different actors. And what we have done is therefore to try to influence or build relationships with these different actors. In the picture that you see before you is Professor Fred and Dean Mary McKay with the First Lady of Uganda. And so what we did was, how are we able to translate the work that has been done with the executive, with the highest leadership in Uganda? And we felt that this strategy would be very important in getting them to understand how valuable this work is. And so we have had engagements with the executive of Uganda, with the highest officers in this country, with the First Lady's office, and also with the Prime Minister's office. The minister that we saw in the video that Professor Fred shared is a statement she made immediately after myself and Professor Fred had a meeting with her over a weekend in her office. And one of the critical things was for these policymakers to actually appreciate and understand that it can be done. And I think what Professor Fred's work has actually done is to build the confidence in the policymakers that this is possible and it can be done. When Professor Fred explained the outcomes of the project and what it was doing to translate the lives of children and vulnerable groups in Masaka region, the minister was dumbfounded and she said, "You mean this can be done?" And Professor Fred was able to show that it actually can be done. And so we have targeted multiple actors. We've engaged with influencers such as UNICEF, where we have had platforms to be able to share and get them to appreciate this work because they actually ultimately influence government policy. But it has not only been at that level. The other area that we've been able to really engage with directly to shape policy is even the lower level, working with the local leaders and the community leaders. So we have had the mayors in the local areas where the projects are being undertaken buy into the idea, the cultural leaders, the religious leaders, because ultimately they actually have an influence on policy. So one of the biggest challenges we have had in Uganda, but all across sub-Saharan Africa, is actually having evidence-driven policy. And so this project and this work that we've been doing is actually helping provide evidence for the policy makers that we have in this country. A lot of the policy has been either externally influenced, but with the work of Smart Africa and ICHAD, we're able to demonstrate that there is indigenous research that actually shows that child development accounts are possible and that they can actually influence and improve on the lives of the most vulnerable. So we have not, we're not yet where we want to be, but I think that we are making very significant progress. We have built very significant relationships. As Dr. Fred said, with USAID, with UNICEF, but also with other stakeholders within the country. We've built relationships with the Ministry of Education, with the Ministry of Gender and Social Development, and these relationships are key to influencing policy. The Uganda National Development Plan 3 that was just launched has been heavily influenced by this work. We now have one of the key pillars as human capital development, and this work directly fits in there. It's definitely our intention to be able to see that as we move forward, as we start with the small steps that the ministers mentioned, the $6 savings for every child that is born, with the evidence that we continue to share with these policymakers, we'll be able to actually have a countrywide program that is actually targeting the most vulnerable and demonstrating that this is actually possible and it's doable. So that is really the experience from Uganda with this work. No doubt that there are challenges, but as Dr. Fred mentioned, we focus on the opportunities, and we're trying to take advantage of the opportunities, especially the opportunity to demonstrate that it is possible and it can change the lives of the vulnerable people in this country. So that is the experience from Uganda. Thank you very much. For this.
So we are extremely grateful to a whole list of people who have really funded us, who have worked with us. And again, it takes a village. I'm from Africa. I don't believe in singleism. I believe that it takes a village for this kind of work to happen, and it will still continue to take a village. Thank you so much. Back to you, Olga.
Thank you so much for this presentation. Okay, now I think we can bring back all the speakers to answer some of the questions from the audience as well as beyond. And we received one question from the audience that asks about the use of funds. So in for many CDA programs, the use of funds is limited to specific uses like education or home ownership. In Israel, it's not limited to any specific use. So this question is for Israel specifically, but we can also talk about it more generally. Is there a concern that the young people in Israel will be spending the funds in ways that is not associated with long-term development? And more generally, how important is it to restrict the use of these accounts to specific uses? And I'll ask Team Israel to jump in first, and of course, everybody can react to that after that.
Sure. I can go, and I'm sure Johnny will have something to add. So I'm personally disappointed a little bit that we were not, the policy proposal was to restrict the money to assets building purposes. What, we have learned from Michael, what we are promoting all this year, like education, homeownership, microenterprise, etc. This not passed like that. They thought that it politically will be really hard to restrict the money. It will be more paternalistic. I personally think that many people might use it for, other less productive purposes than I was hoping, but this is what it is. I'm sure Johnny has some other additional thoughts.
I agree. Originally, I also thought that we should define more clearly what the money is spent on. But as time goes by, I think, maybe we should trust young adults and give them the autonomy to choose what is good for them. And perhaps most of them will make a good choice. And maybe if we limit those choices too much, perhaps that will not necessarily achieve the goals that we need, which are social mobility. So maybe they know better than we do.
So in Uganda, when we started, we restricted the accounts to post-primary education and for starting a small business. But like I indicated, and Timothy has indicated, and Mike actually alluded to this, at least in a country like Uganda, we are building an infrastructure, we are putting together the plumbing, so we are building the evidence. So the most recent study, that we were funded by NIH, the five-year study about, about 4 million, 3.5, we have given opportunity for the women that we recruit in the communities for them to decide what they want to do. But what we are trying to do now with them, we are tracking them using what we call the financial diaries. So we give each of them, so that we want to compare, for those ones that we restricted, compared to those that we gave them an option to decide how does it work out. Because we will need this information when we are influencing policy. We need this information when we are talking to the Speaker of Parliament. So we are lucky that way that we have been able to to design a study where we have restrictions. We have costed it. Now we also have a study where we have no restrictions, and we are using financial diaries to be able to tell how are they spending the amount of money, and we'll be able to tell you, because yeah, so some restrictions, some no restrictions, maybe you need a combination of both.
Thank you. We have another question from the audience. The question is, what are the barriers for putting this type of account programs in place in the US, where it could help many children? And perhaps, Michael, perhaps you could start answering this question. And again, because you already touched base a little bit on, the development accounts in the US as well.
Yes, I'm happy to respond. There are barriers, of course, always political barriers for getting things done, but we've actually made quite a lot of progress, especially at the state level. So I'm not pessimistic about how this will likely develop in the U.S. I think that getting a national framework for this policy, we're a federalist nation. We have state and national government, so it's a little complicated. But there has to be a national framework and national resources if we're going to actually build assets for all the children. So that's on our mind, and that will be that's what we'll be working on. But there are interesting policy discussions now about reparations for slavery, about remedies for other historical harms that have really been put on the national agenda. These may or may not develop into a policy response, but in our view, the framework of child development accounts, because the policy platform is already there, is a very likely candidate for integrating these discussions and resource flows into households in America. So I think there's some really hopeful pathways going forward, and lots of people working on this now. So that's where things stand.
Thank you so much for this. And we're already running out kind of short on time. So I just wanted to ask one last question to everybody, so everybody can jump in with their thoughts. Given that you already know a lot about the accounts, and both countries have some type of either national policy or programs, what top advice would you give to policymakers who are currently considering to implement a new child development accounts policy or program in their country? And we can start with Michael and just go, in the way everybody was presenting, so that everybody can provide their top advice.
Okay, there will be lots of good suggestions here. One way to look at this is to build off of policies that already exist. So, in fact, in the Israeli case, there was working with the resource flows that went into child allowances, and they're able to capture some of those resource flows and put them in a child development account. I'm think when Fred was talking about $6 a month going in, essentially a child allowance, as I understand it, in Uganda, it may be possible to work toward build off that idea and say, well, how about another $6 that goes into a savings account? So it's just easier to build off of policies that already exist than to start something new. I'll just end with that. Other people will have smarter things to say.
Continuing in the order of speakers, I feel that make it simple and then now try having the right infrastructure, kind of like what Michael said. I think that's what made it possible in Israel. It was easier to deliver. You didn't need to build something new. And also, like, one suggestion that always Ray Bushara, my colleague who was also really instrumental in that, is put a proposal that is mimicking where you want to end. So even if you do some demonstration in the process, try to test what you want to be ending up at. So develop it from the very beginning the way you think it can work. And it should be simple, and it should be something that is bipartisan, that everyone can like this idea and things like that.
So I won't change very much from what Michael and Michal said. When I remember when somebody taught me once at university, they said you should use the KISS principle, which is keep it short and simple, and I think that's good for answers, but it's also good for programs. I think we really should have a simple program, one that people understand very easily. It should be universal because then it reaches everybody, but it also should be progressive so that it really helps low-income people.
Yeah. I agree that it has to be universal. I also agree that we need to build on existing infrastructure. In a country like Uganda, we need to take into account the level of development where we are. We cannot say every child who is born gets an account and at age 5, you are losing a given number of young people because of the high infant mortality rate. So it's a matter of figuring out where we are in the level of development and at what stage should we open accounts. Is it at a time when a young person has enrolled in primary 1, because you know for sure they are less susceptible to death. But when they are just born, chances are that, unfortunately, that child may die. So we will figure it out in Uganda differently, slightly different compared to the way they would do it in the US.
Yeah, thank you. I think without repeating anything that has already been said, is really to say that for the policymakers is really take advantage of the available evidence. We now have quite a bit of evidence across countries, and I think it's important for us to build on that to be able to undertake policies that will actually benefit the most vulnerable. Thank you.
Thank you so much for this. And it looks like we have one more final question from the audience, and we just have enough time for this to answer this one final question. Does the future of CDAS lie at the local or national level? And what is the role of CTs? Does someone, we can jump in, whoever has an answer to this question.
So it seems like it's a US question because, I don't know, or Uganda, but it's not Israel because Israel is
That's right.
Universal.
So maybe again, I will refer to Michael. Would you like to again jump in? I know you talked a little bit more about the cities that, the St. Louis is thinking about a program on the city level, as well as certain states are implementing their own programs. So
this is an excellent question. My overall answer is that you shouldn't make this choice. I think there should be national level initiatives and that integrate with local initiatives, and because there's a lot of energy at the local level, and it would be foolish to ignore that and just have some kind of status view. On the other hand, I think there has to be a national framework that makes a sustainable policy. My own view is that many of the city level programs are not on a sustainable platform, are not likely to they're not the programs that are growing. Other cities are not, copying them in great numbers. And so I think now in America, at least 85 and probably 90% of all the children's accounts are on the 529 college savings plan structure, which is a state level structure that is regulated at the federal level. And the reason that matters is because it's sustainable, it's efficient, it's sustainable, and it also can impose the public will. So turning entirely to private sector financial providers is probably not the long-term solution, at least in the US.
Okay, thank you very much for that. Thank you everybody for answering a few audience questions and as well as sharing your experience. And if audience still has more questions, please feel free to email the presenters or us. And to help us just reflect on everything that we have heard today, I would like to also invite Dr. Ozgi Sinsoy Bahar, who is a research assistant professor at Brown School and a co-director of International Center for Child Health and Development at Washington University in St. Louis, to provide some final remarks.
My apologies, my computer is acting up. I would like to start by thanking again our panelists. I think the audience will agree with me that it has been fascinating to hear about how it all started and how CDAs have been implemented in the US from Dr. Sharadan and the unique journey of CDAs in each country, the differences in how they went about implementing them in Uganda and Israel. So in Israel, we heard that the team introduced it at the national level from the get-go. And in Uganda, CDAs have been embedded within a combination intervention with psychosocial support and financial literacy and vocational training components, and were first introduced at the district regional level, building the way up. So, so for next steps in Israel, John recognized that it was a great step forward to introduce a universal CDA in Israel, but also acknowledged that there are some challenges that the program may face along the way that the team is trying to grapple with, and the first one being navigating the potential impact of COVID-19 on the program, and also thinking about more progressive changes on the program, considering that the higher income groups seem to benefit a little bit more from the program than lower income groups. And in Uganda, the next steps are to expand the reach of CDAs to communities that are experiencing negative health and developmental outcomes that are impacted by poverty, like cancer and child labor. And the team is also working on examining the longer term impact of CDAs as children and adolescents are transitioning into young adulthood. Another next step for Uganda is trying to figure out which sectors within the country would be in the best position to deliver this intervention, given that CDAs are embedded within a combination intervention, like I mentioned before, with a psychosocial support component and the financial literacy vocational training component. So what we're trying to tease out at this point is to figure out whether the health system, educational system, or NGOs, or a partnership among those different stakeholders would be the best way to proceed with this type of support communities that are impacted by poverty. And the Uganda team will continue to work closely with national and regional policymakers, providing evidence to inform policy. So those are some of the key takeaway messages, I believe, from our panelists today. And I thank the audience for participating and for the wonderful and thoughtful questions. Thank you, Olga, back to you.
Thank you so much. Thank you so much, everybody, for attending. Thank you.